From Washington, D.C. to your computer, this is Soundbytes with Sam Farr, a timely look at issues of the day. And now, Congressman Sam Farr.
Welcome to another episode of Soundbytes with Sam Farr. Congressman Farr, you've been a congressman now for almost 17 years, longest-serving congressman ever for the Central Coast. How do you put this vote for health care reform into kind of a larger context? Historically, is this the most important bill? How does it compare with other important votes you've taken?
Well, from time to time in politics, big issues come up. You don't necessarily know which issue is going to be really big. It just develops its own kind of sides, it's controversies, and it's always one that's so controversial that there are opposing opinions. I mean, we had this big, heavy vote when I was in the California legislature to ban assault weapons. The NRA and the gun owners were very much against it and lobbied very effectively, and it was a very close vote. I remember here when President Clinton was in office, and he brought to us the budget reconciliation bill, which was essentially a plan for how to pay off the deficit. It was so controversial that not a single Republican voted for it. 42 Democrats in the House voted against it. It passed by just the bare 218 vote margin, which is the majority in the House. And some of those members lost their election. But that was the bill that put the United States on its fiscal feet. We ended up the end of the Clinton era with a surplus, a huge surplus that was squandered away by the Bush administration. They put the Iraq war on a credit card. They put the Afghan war on a credit card. They put prescription drugs on a credit card. They cut the taxes, and they didn't pay for anything. And now we have this incredible deficit. So this healthcare debate is sort of rolled up into everything that is controversial. It's the deficit. It's the economy is in bad shape. It's the fact that people don't trust government. It's all of those things, but there's a lot of good in here too. And this is one of those bills where I think you sit down and compare the two sides with reality, not with false promises and data that's just not substantiated, and you come to the conclusion that there's a lot more good in here than harm. And I think when you see that, I'm elected to be a public servant, and I think to serve the people well, you've got to vote for these things, as controversial as they may be.
Great. Thank you for your time.